Woman, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome to Woman. The menopause is something that comes to all women. It's a sensitive and complex time of life. We have all heard many stories from women who have experienced menopause, some with great difficulty, others with no trouble at all. My guests this evening have some thoughts they would like to share with you. They are Dr. Mary Howell, member of the faculty of Harvard Graduate School of Education, Program in Clinical Psychology and Public Practice, assistant professor on the faculty of Harvard Medical School, and associate dean for student affairs at Harvard Medical School, and Paula Weideiger, author of Cycles of Life, Menstruation and Menopause. Paula is also an associate of Health Right Incorporated in New York City. Welcome to both of you.
Thank you.
Do you think women are adequately prepared for menopause?
No, I don't think so. I think to become adequately prepared for menopause, you have to know about your own body from the time that maybe you were 12 years old, and most of us aren't taught anything about what's happening inside with our hormones or menstrual cycles, and start thinking about it perhaps in our late 40s when menopause is near.
When do you think people usually start thinking about it?
Maybe when their friends start going through menopause, you know, very near the day, I mean maybe in late 40s.
I think for a lot of young women also in our society, there's a sense that menopause is something that happens when you're old. And in fact, considering our average lifespan, we have as many years after menopause as we do during the years when we're menstruating. And I think that that sense of lifespan isn't there for most of us.
What are the most common symptoms?
Oh, I think hot flushes or flashes are probably the most common and sort of either famous or infamous, depending on how you look at it. You know, backache, nervousness, irritability, sometimes insomnia.
Well, some people divide the evidence of menopause. Symptoms kind of a tricky word because it makes it sound as if menopause is a disease. Right? Well, sometimes we talk about pregnancy as if that's a disease, and maybe we shouldn't talk as if it were a sickness. Some people divide the evidence of menopause into three. One has to do with nervous system effects of hormonal change. That is, the change in hormone levels as they affect the pituitary and the hypothalamus, and that's the vascular changes like hot flashes, and some gastrointestinal upset stomach symptoms, and maybe some headaches. Most people think that those last only for a relatively short period of time, a year or two.
A year or two, you said?
Right, compared to some of the other so-called evidences of menopause, which can last for a much bigger piece of your life. There are symptoms that have to do, or evidences of menopause that have to do directly with the change in hormones, and those are probably a change in skin texture and a change in some of the mucous membranes. What happens to a body when the estrogen level goes down, maybe an increased susceptibility to cardiovascular disease. And then the third set, which are part of what everybody thinks about as being menopausal, and that's depression and a lack of self-esteem and a thinking of yourself as being relatively worthless now that you've come to the point where you can't have babies anymore, and that was what your life was all about, and the ones that you had are growing up and going away, and your husband doesn't perhaps need you as much as you thought he would. That whole sense of empty nest syndrome and depression that supposedly goes along with menopause, and in fact just happens at the same time in your life, and is part of the social part of menopause.
I want to get to self-image, but I also want to talk some more about symptoms. You talked about certain symptoms not lasting very long, 1 or 2 years. Well, that seems to me a very long time to have to go through what some women claim are very unpleasant symptoms. And what's a long time, and how long does the process take?
Okay, I think Paula can probably pin it down more exactly than I can, but I'll just answer it very briefly. Some women have virtually none of those kinds of evidence of menopause. Some seem to have a lot. For some, those things last a week or a month or very briefly or intermittently, and for some they last quite intensively for a period of a couple of years.
Yeah.
There's a tremendous range, but so that when I said a couple of years, that's really pretty much the longest average usual time.
It's very hard to say anything very specific about what a particular woman will experience. I mean, you can say that 10% of women seem to have more severe symptoms. 10% of women apparently have no symptoms at all except the cessation of menstrual flow and the end of fertility, and that's it. And the 80% that are left have more than one symptom, but it's not, considered severe. But the symptoms can start before menopause, or you can go through menopause, which is generally now considered 12 consecutive months without menstrual flow, not having any symptoms, and then 2 years later start having hot flushes. So I think that's one of the things that probably makes it more difficult for an individual woman to come to some kind of comfortable terms with it, is because it's so unpredictable, and you can't just go to someone and they'll say, well, okay, now you're having hot flushes, and you can expect it to last for 3 months, and then that will be it forever. I mean, there's just really no timetable, and you don't really know what situation you're in until it's happening. In that sense, it's not clear. But I think it's important to say that, in fact, 80% of women have evidence, I mean, I agree, symptoms is not, it does make it sound like menopause is a disease when, in fact, it's just a natural event in our lives. But have some kinds of bodily or emotional signs that are correlated with the end of fertility. But that only 10% of women are, seriously disabled or troubled.
Is that 10% figure, do you feel encouraging or discouraging?
Well, it depends on, sometimes I think, well, it's only 10%, and then I think 10%, that's 1 out of 10 women, that's terrible, And certainly if you're in that 10%, it's awful. I mean, So I wouldn't just pass it off that it's 10%. But it's a lot of people, when they're younger and they think about menopause, which they then tend to push out of their mind quickly, are convinced that inevitably you go crazy, or you start physically falling apart, or you're no longer interested in sexual activity, and that you're generally wrecked, both emotionally and physically. And then that's in no way probable for any of us in the future, or the women who are in menopause now.
Do you both feel that everyone should see a physician?
Everyone should see if everyone who is fortunate enough to have a physician who will do a good general physical and sit and listen to the questions that you have about your own health should see a physician at a regular interval.
And everyone who can afford it.
And, yes, and assuming that all those other things. One ought to see a physician around some particular signs that might be worrisome. And while
which would be
less,
what, Mary?
let me give you some of them. Less menstrual bleeding, irregular, but generally less, is usually assumed to be okay, an okay way to go into menopause. Increasingly heavy menstrual bleeding is generally assumed to be maybe a worry. Now, there are a lot of people who have increasingly heavy menstrual bleeding and are going through perfectly normal menopause. But people whose menstrual periods are getting very long and very, very heavy, that's a reason to see a physician. Having a hot flash is not a reason to see a physician.
If you're very uncomfortable with it, I mean, is that a reason?
I said having a hot flash.
Oh, okay.
If you have a lot of hot flashes and you're uncomfortable, indeed, that is having some kind of significant complaint, discomfort, worry, question, those are all reasons to see physicians. But one ought not to say, like, it's June, it's time for me to go to the dentist. I'm 49, it's time for me to go to the doctor and talk about menopause. I mean, you go for a reason and not just because it's time.
Yeah, and menopause in itself is not a reason. I mean,
No,
that's what you say.
Yeah.
Only if there are problems. I think, though, it would be very valuable to talk with other women, that I do think,
Yes.
you know, it's 49, it's time to sit down and talk to other women in your
Right.
age group and find out how they're feeling and really compare notes and find out what's normal for you. That's always, I think, the first thing, because all of these sort of statistical things and, well, probably you'll have these and those symptoms, but you won't have that, are really not, well, they're not definite and they're not really that well established factually. But if you do sort of pay attention to what's happening in your body and talk to other women, you really find out, yes, it's perfectly ordinary that you start skipping periods, or, you know, that flow becomes lighter.
You had some workshops, didn't you, that you
Yeah.
led?
Right.
Can you describe what happened in those workshops?
Well, there were two different kinds of workshops. Some were women who were well below the age of menopause, and I think it was really a sort of novel, difficult idea for people to really start seriously talking about menopause and wanting to know about it. And a lot of people, I think, almost felt as though they were talking about death, as though it was still the turn of the century and women died soon after menopause. And it was, a lot had to do with fears of aging in younger women talking about menopause. Menopausal women talking about menopause were very interested in very specific physical issues and what to do about them medically, or if not medically, emotionally, but had a very sort of, well, almost disease-oriented, but I mean problem-oriented, specific
They
physical
wanted
problems.
practical advice.
Right. Whereas I think a lot of younger women really do associate menopause with death, and not surprisingly. I mean, it's no longer comes in close connection with dying, but I think it's still very much associated as the death of femininity and female sexuality, and so, you know.
And inaccurately so.
Oh
we
yes,
should say.
absolutely, inaccurately so. But I mean, it still has that social interpretation put on it, very, very wrong.
Loss of fertility doesn't mean loss of sexuality.
Yeah, or loss of femininity, or, you know, anything like that. No.
Does your sexual appetite decrease at all, appreciably?
Not for
Are
many
you apt
women
to notice it?
I have spoken to.
For many women, it increases, just in the same way that effective contraception often increases women's sexual appetite. Removing the fear of pregnancy often allows sexual appetite to be expressed more comfortably. Another physical difficulty that some women have with menopause that is fixable with medical care is the change in vaginal mucosa that may make intercourse uncomfortable, so that a woman's sexual appetite can be decreased because intercourse is becoming increasingly uncomfortable. And that's another reason to go see a physician, because there is a remedy for that, and it's not a frequent problem with menopause, but it's something that's real, and it's something for which we're glad there's a help.
For a few minutes, let's speak to some of the things that the older women in your workshop brought up, like, for instance, specific treatments.
Well, a lot of women that I've spoken with are almost exclusively interested in the question of estrogen replacement therapy and the so-called controversy about estrogen. My impression is that it's fairly widely known that estrogen is available and given, and people don't know very much about it, are frightened about the idea of taking hormones, but also very much want to know whether or not they ought to. So I think that's been really uniformly the sort of focus of interest. Should you take estrogen or shouldn't you take estrogen? When should you start? You know, when should you stop? What can it really do for you?
Can you answer any of those questions, either of you?
I don't feel, I mean, on a personal basis, no. I certainly am aware of the different points of view that there are. Some physicians really do believe that by the time a woman is in her late 30s, she should start taking estrogen and continue taking it for the rest of her life. And periodically, estrogen is withdrawn and menstrual-like flow appears, and all the sort of signs of menopause just don't appear except the end of fertility. I think most physicians believe in treating, in their language, I think very often symptoms. That is, you wait until you see how you feel. If you have difficulties that are severe enough to make you consult a physician, and then they look like they can be dealt with successfully by estrogen, you give it then. You give it for a while, then you stop it, and you see if the symptoms go away. I think today there are so I imagine in this country, very few physicians who would believe in never giving estrogen to a menopausal woman unless she's had breast cancer or some, serious sign that estrogen shouldn't be administered at all. But I mean, very few people say, keep a stiff upper lip and.
Well, is it or isn't it dangerous?
We don't know.
Yeah.
Nobody has, to my knowledge, nobody has done the adequately controlled series of studies to know what estrogen therapy in a variety of doses and over a variety of treatment schedules and for a variety of periods of treatment, what it does to blood clot kinds of diseases, and that's one other instance where most physicians would not give it regularly is to a woman who's had a blood clot problem in the past. We don't really know what it does with breast cancer. We have a little bit of epidemiologic data, and we think that giving estrogen doesn't do anything bad for breast cancer, but we don't have the really good kinds of epidemiologic studies we should. What we know about blood clot problems and estrogen, we know especially from studies on men, which I think is quite intriguing. There are some good studies of older men in their 70s who had prostate cancer and were given estrogens. And we know that they have a lot of trouble with blood clot diseases when they were given estrogens. We know a little bit about very young women being given birth control pills or other kinds of estrogen therapy. Nobody's done the big study on the women who are the obvious subjects for it, and those are menopausal, postmenopausal women on long-term estrogen therapy.
Yeah, and I do actually, I think that reflects the social sort of perception of menopausal women, which is somehow when you stop being fertile, you sort of stop being visible.
Worth anything.
And, it's really shocking that study hasn't been done. So.
Well, what can a person do to be well informed? I mean, I've read several articles, and some say yes, some say no. I mean, what can you do to make an informed decision, and should it be partly your decision, do you think?
Oh, sure. I think it's has to be partly your decision, and I think largely your decision, assuming that a physician finds no serious medical reason to not give you estrogen, then I think that's where talking to other women really becomes very helpful. You really should talk to women. I mean, I think all medical facilities that attempt to treat menopause or any other issue ought to have, rooms set aside so people can come together and meet, and you should talk to women who've been on estrogen and women who haven't and see how people feel about it and think about how you feel yourself. But there isn't any, tablet you can consult that's going to tell you the absolutely right thing. I don't think. I think it is a personal decision.
You can ask your doctor for the research information, and if your doctor doesn't give it to you, you can go to another doctor until you find one who is willing to do the educating part of being a physician. The people who wrote the book Our Bodies Ourselves started out by saying they'd all been to school and they'd all been told how to look things up in libraries, and there wasn't any reason why, if they worked as a group, they couldn't learn something. And that's really what Paul is suggesting, that a group of women can get that information together and think about it and make the most informed decision you can. And there are going to be some women who are going to say, I don't want the responsibility of deciding, I want my doctor to tell me, and that's all right too. But for those people who want to feel as if they can make decisions about their own lives, that information is not ununderstandable, and it's not magical, and it's not mysterious, and it's just ordinary stuff that you read in libraries, and people can go and read it and teach each other.
The physician's opinion is, in fact, a personal opinion like your own. I mean, based on the same kinds of considerations, what he or she thinks is good, but not knows is good any more than you would by studying the information.
Do you both have feelings about doctors in general in their treatment of menopausal women?
Well, I think that there's a very, I think it almost changes back to treating women as a child. I mean, that's the impression that I've had from a lot of what I've read, particularly, that it's more patronizing than it is during the fertile years. And being patronized by a physician is one of among several different experiences you can have. But there's this kind of more like, there, dear, and it will be all right, and, you know, I mean, I've really been terribly offended by the literature I've read on menopause, written by physicians to help women through this trying time of life, and it's like a Mickey Mouse comes to menopause.
Okay.
And it isn't just physicians. I mean, it's in a lot of areas of our society that postmenopausal women just are not worth very much.
Yeah. Oh, I think it's always good for a laugh, almost. I mean, I've gotten that feeling of, you mentioned menopause, and it's sort of like talking about a stock comedy figure of a red-faced lady, you know, who's got flushes and can't be, you know, it's sort of a ridiculous idea of a ridiculous, helpless person.
You've written a book, and you've had workshops, and you've talked to a lot of women. You must have some feelings on how women can cope more easily with some of the problems related to it.
Well, of course, one way that we've discussed is really by talking with other women and to some extent learning as much as you can about your body and the options that are available. But I must say, I think that the overriding issue is really a change in women's, women learning about what it is to be a woman from women's experience, and really changing the attitude that men or the world of men define women. Because I think if women define themselves, no one would think that fertility, the end of fertility, was the end of life. You know, and that would make a big difference in how men and women experience menopause.
Do you have some thought on that, Mary?
Yeah, I think that the thought that women have as many years of their lives after menopause as they do between the time that they begin their menses and come to menopause is really quite a startling thing for most women in this society to think about. And I think one of the ways to prepare for menopause is to understand about that and to put one's childbearing, child-rearing years into some perspective. First of all, there are a lot of women who choose not to be parents. But even for women who are mothers in the average kind of family, it's something like, Alice Rossi has the figures, it's something like 4 years of your life that you're really a full-time mother, and the rest of the time your kids are, maybe it's more like 6, but the rest of the time your kids are in school most of the time and increasingly out of the house, and to define yourself as being a mother first and foremost, and that is the most important, not only the most important, but the sole important thing that you do in your life. Well, if it's the only important thing that you do, then when your kids have, not when you're menopausal, but when your kids have left, you're not important anymore. Whatever else there is to you, whatever else you do of substance, which need not be a paid job, but might be, is also part of what defines you, and that clearly goes on even when your last baby has grown up and left the house. I mean, that you don't then disappear as a person.
One of the things, Paula, that I was curious about, you told me about a study about women who are institutionalized with menopausal symptoms, depression, severe depression, and who were these women?
Well, the greatest population of women who were institutionalized for menopause-related depression were middle-class white housewives, most of whom were Jewish, who had identified very, very strongly with the role of, well, I mean, in my mind, I think of it as supermom. I mean, really, where your only identity was going to be being a mother. And I really think, given that women can expect to live at least a quarter of a century after menopause, that however much those women were educated to believe that women have to consider having children and raising a family as, if it's a full-time career, a first career, and that there really has to be a second one, because it was really dramatic for me when I read that study and realized it's just the women who are taking upon themselves most, seriously and conscientiously this kind of social role of being a good mother and a good woman, who are having emotionally the most difficult time in menopause.
But physicians sometimes say that, you know, you're having difficulty with, say, menstrual cramps or menopause because you're not accepting your role as a woman.
Yeah, well, you get it both ways. When you're in the menstruating years, you're told that a lot of menstrual problems are because you don't have enough children, or they'll go away when you have children, or you're not, involved enough in your home. And then when you come to menopause, almost everything that you read or hear that sort of conventionally is said is, well, now you have to find something interesting to do outside of the home. I mean, you really can't count on this anymore. So you really are getting it both ways. And in fact, a study was done of women who have a lot of trouble with menstruation, and it was found indeed that women, again, who took upon themselves most seriously the idea of to be feminine is to be a good wife and mother. Only. And had no major interest, interest in their own definition that they considered serious, other than that, expected to have a lot of trouble with menstruation, and did.
Very quickly, because we're almost out of time, what about women who have hysterectomies? Do they have special problems, do you think?
Well, they are surgically castrated, and their menopause comes all at once, and they have this can't be done quickly.
I know.
The difference between women who have hysterectomies and women who also have ovaries taken out makes the answer complicated. And if the ovaries are also taken out and the uterus, then they have menopause all at once and a different set of symptoms, and those are most often young women.
But it's very interesting that relatively very young women, like women who are in their 20s, who have their ovaries removed surgically, tend not to have such severe symptoms, but that once you get into your 30s and after, if you have your ovaries removed with or without removal of uterus, you tend to have severe menopausal symptoms, which some people are suggesting is a kind of withdrawal, as though the body becomes addicted to estrogen.
Here's a yes or no. Do women who are experiencing menopause need to use birth control?
Yeah, until they're definitely sure that menopause is an accomplished fact and fertility has ended, which is,
okay,
as I
thank
say,
you very much. I'm sorry we're out of
Okay.
time. Thank you for watching. Good night. See you next week.
Production funding provided by public television stations, the Ford Foundation, and the Corporation for Public Broadcasting.